Sciatica. What is it? So, I hear this all the time. Dr. Dan, my sciatica is acting up. I have sciatica in my leg. Today, I'm sciatic. So before we get into what sciatica actually is, ask yourself this. Have you, or anyone you know, ever felt burning, tingling, stabbing pains in the leg, specifically one leg, numbness, tingling, or difficulty walking? If so, the odds are what you most likely experienced was in fact sciatica. Now, unfortunately, the term sciatica gets misused often as both a diagnosis and a symptom. In fact, sciatica is a symptom or a group of symptoms of a larger underlying issue. Let's talk about it. Now, some of the major causes of sciatica, again, that tingling, numbness, stabbing, burning, weakness in one leg versus the other. Now again, not all of those symptoms have to be present. So the major causes include lumbar disc herniation, degenerative disc disease, spinal stenosis, facet joint irritation, as well as piriformis syndrome. We're going to go through each one of those individually and highlight the aspects of each. So let's break it down. This here is our sciatic nerve. It runs from our lumbar spine down into our lower limb. It's also one of the largest nerves in our body. In our spinal column, we have vertebrae separated by fluid-filled discs, which allow our spine to be mobile. When those discs are overloaded, we can have what's called a disc herniation, which is akin to having the jelly part of a donut squeezed out. If the herniation material reaches far enough to put pressure on a nerve, then you can have sciatica-like symptoms occur. Degenerative disc disease indicates that those same discs are worn and no longer as plump, reducing the amount of space between the vertebra, which can put pressure on the nerves. This is true with spinal stenosis as well, where the space the nerves exit from is reduced and sciatica symptoms result. This can also happen acutely when a joint in the spine becomes inflamed due to trauma or sudden increase in use, putting pressure on the nerve exiting the joint space. Lastly, and very commonly, sciatica is caused by pressure placed on the sciatic nerve at the buttocks by a muscle called the piriformis. This muscle can become either tight or inflamed due to overuse or trauma. For example, by repetitive actions like sitting on a wallet, or by poor seat cushioning. So as you can see, there are a lot of potential causes for your sciatica. Chiropractors, being spinal health experts, have the advantage of being able to assess and determine the root cause, and the tools to treat it successfully. Now, if you or anyone you know is experiencing those numbness, tingling, stabbing sensations in one leg or the other symptoms we've discussed, share this video with them. Having the root cause of your sciatica treated is the healthiest way to avoid pain, chronic pain, and future disability. Take care. If you enjoyed this video and found it informational, leave me a comment in the area below. Also, feel free to post any topics you'd like covered in a future segment. Take care. We'll see you soon.